This is a video demonstration to support techniques and procedures used in the book Korean Kinetic Acupuncture, Acupuncture's Next Generation Muscle Trigger Point Technique by Dr. Evan Mahoney. In no way should this be used by those without completed education, license, and degree in the curriculum of acupuncture and oriental medicine. Further training is recommended before one should begin practicing these techniques. The author takes no responsibility for mistakes or medical errors caused by those practicing these techniques. This video will not have needle insertion demonstration. For purposes of this book, these techniques should only be used for complaints of pain unless otherwise stated. It is to be understood that the practitioner using these techniques has a full understanding of acupuncture safety, contraindications, and proper needle location and insertion depth. Okay, this is a Korean kinetic acupuncture sample video demonstration. Today we are going to stretch the anterior tibialis muscle and extensor digitorum longus. So we're going to work on these muscles to benefit the top of the foot for any kind of foot pain or toe pain on the dorsum of the foot. There's two procedures to the anterior tibialis. The first is in this position, the patient's supine, they're on the table, and we're going to do a kinetic acupuncture technique. The second is just a stretch only, which we will demonstrate in part 2 of this video. So we extend the foot, or we plantar flex the foot, and we massage along the line of the anterior tibialis, finding the tender trigger point areas. They're usually along the stomach channel or the gallbladder channel. So you find the tender trigger point areas, and then you insert the needles along the muscles anywhere where you feel those trigger points. With the foot plantar flexed, you're going to instruct the patient to lift the foot up against your resistance of the hand. The needles are in place. The patient comfort level has been assured by moving the foot up and down and the needles in place. So with the foot plantar flexed, the patient's instructed to lift the foot up. Go ahead and lift up. 1, 2, 3, 4, relax. Again, lift up. 1, 2, 3, 4, relax. Again, lift up. 1, 2, 3, 4, relax. You can repeat this 5 to 10 times. Now, take the needles out. Now this primes us for procedure number 2, which is what we're going to do next. So I'm going to ask the patient now to get on their knees. Can you sit on your knees, hon? Okay, so this is a stretch. Be careful with the stretch. Some patients may have some knee pain doing this. The quads may be tight, so the patient may not be able to sit fully back on their feet. But go ahead and sit back. So the patient sits back fully on their feet. You'll see that the foot is plantar flexed, thereby stretching the anterior tibialis. So in this position, again, no needles in place. The practitioner simply grabs at the bottom of the foot and then lifts it up, counting 1, 2, 3, 4, relax. Counting 1, 2, 3, 4, relax. Counting 1, 2, 3, 4, relax. And they may feel a tightness. If this muscle's tight, it may be sore at the top of the foot, the tendons. So be very careful with this. They may not be fully able to sit back. They may be restricted in their motion. So you have to be cautious about this stretch. But if they are able to go back as far as they can, and then you just gently lift the foot up. Try not to lift the foot up too much. Just go with whatever the patient comfort level is.